Thanks so much for making time to join us today. We're really excited about the discussion and having the privilege of Dr. Romi Chopra joining us. Dr. Romi Chopra is interventional vascular and women's health specialist based in Chicago, and he's been using Cara for about a year now. Just want to welcome Dr. Chopra. You want to say hello?
Thank you. Yes, hello to everybody.
Great. So I'll get started. This is Ryan Flash, and I'm our Vice President of Growth and Strategy at Cara, based up in Seattle. And want to just walk through some housekeeping items for today. We'll plan for a half hour's time, and we'll spend the first 15 minutes doing kind of an overview of how Cara works, some present issues with charting, where you can use Cara today as a virtual assistant, what type of tasks Cara performs. And then we'll transition in the last 15 minutes, and we'll hear from Dr. Chopra how he's using Cara today, some of his experiences, and then we'll save some time for Q&A as well for both Dr. Chopra and myself. So with that, please use the Q&A mechanism if you can, rather than the chat to engage me, okay? Use that, and then at the end, we'll go through and answer as many of those as we can. For those that we can't answer today, we will follow up on an email. So rest assured, we'll try to get to all of your questions. Great, well with that, why don't we get started? And so for many of you are familiar with the challenges that most physicians are facing with the burden of clinical documentation. And of course, this has led to record levels of physician burnout and sadly, clinical depression as well. And the average physician is spending 2 to 3 hours a night just trying to catch up from the workload during the day. And the overall time in the EHR is almost 6 hours. And the average physician is working 12 hours a day, so that's at least half of their day. And there's usually a 2-to-1 ratio for every hour you spend with the patient, you're 2 hours in the EHR. And of course, we know that not all the time in the EHR is charting, but it does represent a significant part and probably the biggest pain point for most physicians in their workflow. So what is Cara? So Cara is a voice-enabled virtual assistant designed to facilitate documentation and charting. And the primary use case is an ambient setting inside the exam room. And so Cara lives in the cloud in a HIPAA secure environment, and Cara is deployed over an iOS device. Cara can be deployed over any of the Apple devices, and is leveraging some of the great consumer technology by Apple, including the microphone, which is really outstanding on the platform. So you're not required to buy separate microphones or separate speakers, like a smart speaker like from Amazon or Siri. You don't have to plug anything in. And the experience that we're trying to deliver is a hands-free, screen-free charting experience where you can maintain eye contact with the patient without being distracted by the keyboard and mouse and of course the screen. And so there's very little contact with the EHR that you have to make when it comes to actually documenting the chart itself. Okay, you may still have to go and look through the EHR for like an X-ray or MRI or reference something else in the EHR, but when it comes to actual documentation, the idea here is that you can offload that to Cara and eliminate all the scut work that most clinicians really loathe doing. Okay. So how does this work? So Cara is a combination of speech recognition, natural language processing, and machine learning. And we do that in-house here. We have subject matter expertise. Our founder was the former CTO at Nuance, as a matter of fact. But we call this an augmented AI because the state of AI as it exists today is not 100% autonomous, but we are a text-first approach. And the methodology is to remove the physician from having to be the editor. In the case of traditional speech rec products that you're probably familiar with, they still tether you to a screen. You still have to use the mouse, and you have to be the editor. Cara is trying to remove that paradigm completely. And to do that, we want to produce a 100% accurate and meaningful note that's synthesized both by leveraging machine learning as well as having what we call a reviewer in the loop to do quality assurance on each and every note. And so the ultimate experience we're trying to create is this ambient in-room setting. And the idea here is that the physician does not have to take any notes, and the physician does not have to commit anything to memory. And you can walk out of the exam and be completely offloading all of your data entry work, not just the chart, but also including other high-value tasks, which I'll talk about later, such as orders, referrals, and scheduling. So where can you use Cara? I mentioned the exam room obviously is the ultimate because it provides for the hands-free experience. But because it is just you and Karen and your phone, you can really use Cara anywhere you like. But unlike speech-to-text platforms, this is a speech to intent. And so you don't, even using Cara outside of the exam room does not require you to regurgitate word for word what happened. You can just simply summarize to Cara, much like you would to a colleague. And so Cara can work almost like a digital resident, if you will, in that respect. So you can do as much in the room or as little as you like. And we know there'll be scenarios where there'll be a sensitive assessment that you wouldn't want to give in front of the patient, for example, or if you had a behavioral health issue that you, of course, didn't want to communicate an assessment in front of the patient. Okay, so wherever you have an internet signal, whether it's a cell phone or Wi-Fi, sorry, cell signal or Wi-Fi, you're perfectly fine, and it requires standard broadband internet communication rates. So what type of tasks can Cara perform? Our primary focus to begin with, to reduce the documentation burn and reduce symptoms of burnout, certainly is clinical notes, because that's the lion's share of the work effort. But we know that other very important tasks, such as orders, whether it's medications, diagnostic tests, or labs, or even surgical orders, they do take time. And sadly, speech recognition, at least legacy systems, do not address that workflow. They just convert a text to a word or a statement to a word, but they don't generate commands, and certainly they don't really understand what you're trying to convey. And so we perform orders in that respect, and we do integrate. And why don't I take this time? Cara can integrate with every EHR. We've done integrations with the 5 most popular, but we do support every EHR workflow. And in addition to orders, we can also perform other high-value tasks like referrals and scheduling. So Cara's working almost in a detethered mode that is also then asynchronously working in the background to complete and synthesize the note and other high-value tasks in the EHR. So the workflow for the physician is that Cara is then preparing the preliminary note. It should be, near 100% perfect. And then the physician would go into their EHR and review the notes and sign off. Cara, there is a time of flight and for this process, because we do have a reviewer in the loop. And we can do it as fast as about under an hour. And then we have a mode to do it same day. And then we also have a delayed model of next day, which is akin to the old transcription turnaround times. So the more time that you give us, the more economical. Many of our customers elect to do same day for the purposes of having a clean slate before they go home and signing off on everything at that point. But the physician should not have to be the editor, and you should not have to make corrections. You know, unless you want to add an order or something changed from the time that you saw the patient, the time you reviewed it, should be the only reason that you'd have to go in and edit in the EHR at that point. I want to just pause there and transition. Again, welcome Dr. Romi Chopra. And let's hear from him about his experience. Again, Dr. Chopra is a vascular and venous and women's health interventionalist in Chicago. And he has several centers scattered around the Chicago Metroland area. So again, welcome Dr. Chopra. Can you hear us okay?
Yes, I can. Thank you. And I hope you can hear me well.
Yeah, we can hear you great. Yep, thanks for bearing with us there with the technicalities.
No worries at all. Such is life. And, you know, I've been using Sakura now, as you know, for over a year. And when I first stumbled upon it by talking to you, I realized the value right away. I was looking for scribes and piloted this in many different ways. I'd taken MA into the room. Or the notes got very cryptic because I just didn't want to spend all that time. And our model of care is very different in the sense that, you know, we are very high touch and high tech. So we believe that you got to first invest in your patient's success. So we are centered on the patient. We want to stay connected with the patient. We collaborate and we are mobile. So we have multiple locations. And we follow the patient everywhere: home, nursing home, short-term, long-term acute care. And majority of our work is done outpatient. And I truly believe that people feel before they think. So if you're looking at a computer and talking to another human being, they really don't connect with you. And so I don't leave the room till I'm satisfied that the patient is satisfied with me, and we make that connection. So I was looking for a scribe, and I used to have my PAs always with me, and they are providers too, and they would be a wasted resource as a scribe, so to speak. We tried medical assistants, etc. So we started with Sakura just initially transitioning almost like a dictation system, not knowing what it could do. Then slowly I started to realize that there was way more to it. So I've done it in the ambient mode, where I just leave the phone on there, talk to it. And in the time, a short while later, you see the whole note ready. I mean, I would see it on the iPhone itself, but then see it in my EMR ready to go. I've kind of migrated a little bit more to, because our patients have a very focused disease path. We are mainly down vascular, and they don't come up to us with totally unknown problems. So I started doing more of the summary mode, where as soon as I'm done talking to them, I would basically talk as if I'm entering into my EMR. And within 7 minutes or so, I would have my whole thing done. And I had created a template in one, either verbally in my mind or just had a kind of a template created for me on my phone. I'd look at it and make sure I completed all the points, from chief complaints to all the way down to the orders. As you know, we also use this when we do complex procedures. We have a structured EMR where we track every little bit of it, but we also like a narrative and a summary. So I create that almost like an op note as well, and it gets thrown into our EMR in the op note section, and it gets done. The best case, and now all my providers are on it. Everybody uses it to a varying degree, and we're getting better with it every day. So, and one of my nurses, advanced practice nurse Margaret Kress, she initially talked about burnout. She was 70 reports behind, with stressful nights, weekends, days. And if you talk to her now, her bandwidth opened up by 50%. And within 24 hours or so, she's back in touch. And we see patients all over the city in multiple locations, et cetera. So it's been a phenomenal benefit for us. I could go on and on, but if there are questions, I'll happily answer them.
So, what were some of your skepticisms, Dr. Chopra, beforehand? I mean, there's all this hype around AI, and there's been certainly some disappointment in healthcare. We haven't seen, major traction and the results, and a lot of it's retrospective. And this is really a workflow. So, tell me about what that was like for you and transition.
Yes, I think, you hit it on the head. So we've been using dictation forever. But first is you say whatever, then somebody types it up. Then you got to remember what you said and how you said it. You got to edit it. You got to put it in the right place. Just a lot more work. And it wasn't even structured data. And then people say AI all the time. And I've kind of gotten tired of that, too, as you said, because they make it sound like it's magical, but it's not. But when you look in real life, I talk to my car, I talk to my phone, I give instructions to my phone. You have Alexa, you have Siri. And then initially I was a little skeptical to say, will it just happen automatically? But you had the magic word, workflow. So I knew there was a process to it. And any tool, we'd have to learn how to use it well. So we started by taking one patient, just kind of playing with it, seeing how it would work. We piloted for a little while. But the skepticism melted away very quickly for me. But then I'd have other providers who'd say, well, I'm not too sure, I have to correct it. But soon they learned that with machine learning and with augmented learning, basically you have a reviewer looking at it, and the more data you have in, the more you work on it, the better the system gets with it. So I've gotten to now where I just talk to it, and I know my notes 90% accurate, and to me, that's the AI part of it. So that was the initial skepticism, but once you set it up, then it starts to work very well.
How long did that take?
Maybe a few weeks. For me, it was very quick because I could see the value, but then as I started, every provider took a little different time frame. I still have one or two who are sometimes not 100% sure, but it depends on how comfortable people are with technology. But on average, it was just a couple of weeks that you got used to it. I mean, some of my providers are totally addicted to it now, and others still don't know all the benefits, but that's a learning process. But it was just a few weeks, a couple of weeks at max.
Okay, very good. So it was a very short learning curve for everyone.
Absolutely, very, very short indeed.
And how did it change in terms of, completing chart time and, getting home on time and your productivity? And you mentioned it, you touched on that a little bit when you started, but could you, give us more detail on that?
So, we are addicted to companies like Amazon, Costco, and they have a simple paradigm. The triple constraints of life and getting things done. It is to do it better, faster, and cheaper. So one was my notes were more accurate because I didn't have to type every single word out. Second, I got it way faster. And then third, in the end, cost, because I had to have the biggest cost we have is, our labor productivity as humans, as providers, it's several $100s an hour, down all the way to all the support systems. So we started optimizing our workflows. We started increasing volume, and we have some very aggressive targets without adding more labor and people to it. And we kept optimizing, and we still are optimizing our system. So for me now, and for us, Cara has become part of our system and workflow. If somebody wants to type, it's their time, their productivity. Everybody's based on productivity. They soon realize I better speak into this, use this. Life's going to be much better and faster.
Okay, very good.
I hope that answers your question.
No, that's great. Appreciate that. And what kind of advice would you have for someone that using this for the first time, whether they've had experience with speech recognition or dictation or otherwise? What kind of advice would you have?
So just about anything we do in life, I say plan twice, cut once, and understand what your workflow is going to be like, and then kind of gradually ramp it up versus overnight without looking at the process, suddenly magically think it work out. We've gotten where I've had other providers ask me, can you help set this up for us outside of our practice? And we're looking at things like that. But that's the first advice. And when you do this a little organized, as you track, for example, even a day, how much time you spent on it. And then as you plan this and ramp this up, do it one segment at a time, do office visits at a time, a certain type. But if you just do it randomly, the outcome may not be as good as you want it. Versus you put some thought into it, look at your workflow, look at what you want to say, what your templates are. For example, if you do counseling or if you do what your codes are going to be, what is your plan and how you will structure that in, at least you hit all the points. The system cannot think for you. You will still do what you do as a physician. It is, the way I look at it, it's my virtual, brilliant scribe and does it accurately. I hope that makes sense to you.
Yeah, no, that absolutely makes good sense. That's great. Thank you. Well, if you could hold tight there, Dr. Chopra, we might have some more questions. We'll go through those in just a second. And just as a reminder, for those that are on the webinar, if you've got some questions, now would be a good time to start queuing those up. We'll try to go through these kind of one by one. And so I just want to recap a little bit of what we talked about here in our short time. When we think about a virtual assistant, leveraging AI and machine learning, what we're seeing is that clinicians are spending 70% less time on documentation. And of course, that translates into time saved. And it's going to vary based on your specialty and how many patients you see each day. It generally means saving 1 to 3 hours a day. And then what you do with that time is obviously up to you, whether or not you just want to spend more time in the room with the patient, or you just want to get home early, or to eliminate, of course, the dreaded after hours pajama time. And for many clinicians, including Dr. Chopra, they've elected to just use that time to see more patients and be more efficient. And so, of course, there's a really good ROI with that. And for those that are on the call that are using scribes, scribes are effective. They just come at a high cost and the turnover factor. And so Cara is just a much more economical model without the turnover challenges. And again, as a reminder, this technology is available just on your phone and on an iPhone. And I'll go into that a little bit later in some of the QA, I imagine, but we'll say we support iPhone 7 or higher. And if you don't have an iPhone, we'll just loan you one at no cost. Okay, but these are the main metrics that we are tracking, and we're very focused on making certain we have 100% success to eliminate the pain points that many physicians are experiencing. So let's transition to Q&A. I've listed my contact information here too as well on a website, and we're going to be attending a number of conferences in the next few months. So if you are attending these, please come by and visit us. We'll be at HIMSS in about a month, and then AMGA, and then AOS as well. So I'm trying to simulate some of these questions, but there was a common thread. How long does it take to deploy this type of solution? And Romi, maybe you can touch base. How long did it take for you to deploy it?
Ours was just essentially a couple of days. We got the phone, we worked with somebody from your team, and I was up and running over a couple of days. Now I started one myself, but then from internally, as we added on providers, each one of them was up and running in just a couple of days.
Wow. Okay, great. What's the biggest challenge you face in switching from speech recognition to a virtual assistant?
I think the challenge here was providers were not used to it, including myself initially. So, if you're just having a conversation in a room and you have to ask the patient the right questions as well as you're doing what you're doing, and then just had to get used to that. So what I did the first time was, for example, I treat a lot of patients with venous disease and arterial disease. I just, based on the EMR, I had a template anyway, things I had to make sure that I had the chief complaints, I asked them the right questions, because that also needs to get tied into coding, the different characteristics that you need to have to code to a certain level, plus then go through the examination. So I had just created a little cheat sheet for myself initially on the summary side. So I made sure everything was completed, including my plan, my discussion. And I talked to Sakura like I was talking to somebody else. And I'd say, the care coordinator needs to coordinate for this, that. All that would get thrown into the plan section of it. So I think that that kind of initial reluctance was on my mind was, will this work? And then once it was set in, it's a no-brainer. And I think that's the part that you feel resistance from people who haven't done it before. So once we created the template, the people who started taking it up just flew through it.
Okay, that makes sense. I think we got time for one more question. I've seen a few questions about EHRs. What's the integration or experience like with what Cara is doing, and then what that looks like in your EHR, what that workflow is?
For us, if that question's for me,
Yeah.
what we've done is, as you know, we use med streaming, and your team and your folks have been awesome with it. Honestly, to me, I don't know all the technical aspects of what you did, but we have an MA license for one of the reviewer, and we just see it in our EMR. So for us, that's been a no-brainer too. I'm sure we could do more sophisticated things with APIs and things like that in the future. But right now we are on a ramp up mode. We are growing. We grew 40% last year, and we want to grow double this year. So as we are doing that, we're not spent as much time on the technical side of this, but it's been super easy from what you folks have done.
That's good. That's good to hear. And you're which EHR are you on again? You're not on a popular one, right? It's not like
Oh, no, it's very popular. There are several thousand sites across the country. It's designed for our vascular. So we do primary care. We see patients in homes, nursing homes, long-term, the LTAC stacks as in acute care hospitals. We dictated all of that into Sakura, gets into our EMR. We've even done where we have some interfaces with other systems where from our EMR, the information goes out. So for us, it has become a rapid turnaround from Sakura to the EMR, and the EMR is popular. We use it for even structured. So it's med streaming, which is based out of Seattle, and so we do primary care, vascular, which is our two main areas, and they're very big and large and popular.
And if I remember right, you were a speech recognition user with Dragon before, and of course with that you have editing. So when you transitioned to
we got rid.
Say Cara, did you have to do much editing on the note after Cara synthesized the note for you?
No, actually, no, we don't. Actually, I used to use Dragon. They come out with the new one called the Dragon Mobile. So first of all, it cost me a couple $100 per user per month. And then I'd have to dictate it, edit it, work on this, all that stuff. And it just got too much for me. So once I got on Sakura, I got rid of that. Because sometimes we've seen that as I'm speaking on the iPhone, I see the processing sign, and I don't know how your processing works, but sometimes it's super fast, and I'll see the text ready right there. By the time I'm out of the room, I have all my notes right there, and I've rarely had to edit it.
That's great to hear. No, thank you for that feedback. I know that there's a couple more questions, and I know we're short on time, and I want to respect everyone, especially that I kept you behind to begin with. So I will follow up independently for those that have questions we did not answer. But I do very much want to thank you for your time. And I also want to give a special acknowledgement to Dr. Chopra for making time out of his busy day as well. And we really appreciate your participation here, Dr. Chopra. I know it's very valuable for any clinician that can relate with your day-to-day and the workflow you experience.
Yes, absolutely.
Well, thank you so much, Chopra, and everyone. You can, as I mentioned earlier, if you have questions, certainly follow up. You can reach us on our website or my direct email. I'm also available on LinkedIn, and I'll be at these conferences, so please reach out. And we will make this available to you as well in a recorded model. If you would like, just go ahead and request that. So thank you once again, and have a great remainder of the day. And thank you, Dr. Chopra.
Thank you. Pleasure.
Okay, good afternoon. Bye-bye.